Every morning, in bathrooms and kitchens all over the country, the same small ritual happens. A cap twists open. A pill drops into a palm. A glass of water follows. No drama, no thought. Just a habit repeated so many times it barely registers anymore. That pill is usually a multivitamin, and it is one of the most quietly popular products on the planet. Almost 1 in 3 adults in the United States takes one regularly. And globally, the supplement industry built around that little capsule is worth well over $100 billion a year. So why does a pill with no taste, no immediate effect, and honestly not much drama attached to it, get taken by so many people every single day for years or even decades? The short answer is insurance. People take it the same way they buy car insurance, hoping never to need it but sleeping better knowing it is there. The idea that a little bottle of vitamins could work like insurance for your body did not appear out of nowhere. It goes back to one of the strangest medical mysteries in history: scurvy. For centuries, sailors on long ocean voyages died by the thousands from a disease that rotted their gums, opened old wounds, and drained their energy until their hearts simply gave out. Nobody knew why. It took until the 1700s for a British Navy doctor to figure out that citrus fruit prevented it, decades before anyone understood what was actually in the fruit that mattered. That mystery ingredient would not get a name for almost 200 more years. In the 1930s, chemists finally isolated it and called it vitamin C, part of a whole new category of compounds the body needs in tiny amounts but cannot make on its own. Vitamins, short for vital amines, became one of the biggest discoveries in the history of medicine. And once scientists proved that a missing vitamin could cause a deadly disease, the logic seemed obvious. If a lack of something makes you sick, then surely having more of it should make you healthier. That single idea launched an entire industry, and it has shaped how people think about nutrition for almost a century. By the middle of the 20th century, multivitamins were being marketed as a kind of nutritional safety net, a way to patch the gaps in an imperfect diet and quietly stack the odds in your favor. Have you ever wondered whether that promise actually held up once scientists finally put it to the test? It did, starting in the 1980 and 1990, when researchers ran some of the biggest, most expensive vitamin trials ever attempted. And the results were not what the vitamin industry, or honestly most scientists, were expecting. One of those trials targeted beta-carotene, the compound that gives carrots their color and that the body converts into vitamin A. Researchers gave high doses to smokers and asbestos workers, people already at high risk of lung cancer, expecting the antioxidant to protect them. The trial had to be stopped early, not because it was working too well, but because the group taking beta-carotene was developing lung cancer and dying at a noticeably higher rate than the group taking a placebo. A vitamin, thought to be protective, appeared to be doing real harm in that specific group. A separate trial in Finland found almost the exact same thing around the same time, in a different population, using a similar dose of the same compound. 2 independent studies landing on the same uncomfortable result is not something researchers can wave away as a fluke. Years later, a massive trial testing vitamin E for prostate cancer prevention ran into its own reversal. Tens of thousands of men took vitamin E for years expecting a protective effect. When the numbers came in, the men taking vitamin E actually had a higher rate of prostate cancer than the men taking a placebo. 3 separate cases, 3 different vitamins, 3 trials designed to prove a benefit that instead uncovered a risk nobody had planned for. It is worth sitting with that for a second, because it cracks open an assumption most people never question. Those specific trials used high, isolated doses of single compounds, not the modest, broad blend found in a typical multivitamin. So a fair question follows naturally. Does an ordinary daily multivitamin, the kind sitting in millions of medicine cabinets, actually carry the same kind of risk or the same kind of hidden benefit? For decades, the honest answer from science has been a shrug. Some studies that tracked large groups of multivitamin users over time found a lower risk of dying. Others found no difference whatsoever. A handful even pointed towards slightly higher risk. Reading the research on this topic feels less like reading a settled textbook and more like watching a coin flip land differently every time. Part of the mess comes down to who actually takes multivitamins in the first place. Compared with non-users, daily multivitamin users tend to be older, more often college-educated, more likely to exercise, and less likely to smoke. That pattern has a name among researchers: the healthy user effect. People who already take care of themselves in a dozen other ways are also more likely to reach for a vitamin bottle, which can make the vitamin itself look protective even if it is doing nothing at all. There is a mirror image of that bias too, called the sick user effect. Someone who just got a worrying diagnosis, or who is already managing a chronic illness, often starts taking supplements specifically because they are trying to do something, anything, to improve their odds. That pattern can make a vitamin look harmful in the data, purely because sicker people were more likely to start taking it in the first place. Untangling those two opposite biases from any real effect of the vitamin itself is genuinely difficult, and it is exactly why the research on multivitamins has stayed muddled for so long. In 2022, the group of independent experts that reviews preventive medicine in the United States looked at 9 separate randomized trials on multivitamins and came to a striking conclusion. There simply was not enough solid evidence to say whether multivitamins help or harm when it comes to preventing cardiovascular disease or cancer. Not harmful, not helpful, just genuinely unknown, after decades of a huge share of the population taking them every single day. That is a strange place for science to be stuck, and it is exactly the gap a team of researchers at the National Cancer Institute set out to close. Instead of running yet another short trial, they did something different. They combined data from 3 of the largest, longest-running health studies ever conducted in the United States, treating them as one enormous natural experiment that had already been quietly running for decades. The first piece came from a study that mailed detailed health questionnaires to ARP members back in the mid-1990s, eventually gathering information from hundreds of thousands of adults across the country. The second came from a major cancer screening trial run at 10 medical centers nationwide. The third followed licensed pesticide applicators and their families on farms in Iowa and North Carolina, a very different population that added real diversity to the picture. Combine 3 of the biggest health studies ever run in the United States, follow people for over 20 years, and you get one of the largest natural experiments on this question that has ever existed. Stick around, because the answer that came out of that data was not the one the vitamin aisle has been quietly promising for the last 80 years. After excluding anyone who already had cancer, diabetes, a heart attack, or a stroke at the start, so the results would reflect genuinely healthy adults rather than people already managing serious illness, the researchers ended up with a combined group of 390,124 people. Participants had reported on repeated questionnaires over the years whether they took a multivitamin never, occasionally, or every single day. That last group, the daily users, is the one this whole question really hinges on. The researchers then tracked every one of those 390,124 people for a combined total of over 8 million person-years, an almost unimaginable amount of observed human life, using national death records to see exactly who died, when, and from what. By the end of that tracking period, 164,762 of the original participants had died. That is a huge number of outcomes to analyze, which is exactly what gives this kind of pooled study so much more statistical power than any single trial that came before it. So after tracking 390,124 people for over 20 years, did daily multivitamin users actually end up living longer? Here is the part that surprised a lot of people who follow this research closely. Comparing daily multivitamin users against people who never took one, daily users did not show a lower risk of death. If anything, their risk of dying from any cause was about 4% higher during the first half of the follow-up period. A small difference, but a statistically real one. When the researchers broke that overall number down by specific cause of death, heart disease, cancer, and stroke, the picture stayed unremarkable rather than alarming. Risk for each individual cause hovered close to even, meaning multivitamin use was not clearly tied to more, or fewer, deaths from any one of those conditions specifically. A second, separate analysis checked in on people's multivitamin habits again years after the study began, tracking changes over time, instead of relying on a single snapshot from the beginning. That follow-up analysis landed on the same conclusion as the first one: daily use, no visible longevity benefit. It is worth repeating the 2 biases from earlier here, because this is exactly where they matter most. This is an observational study, not a trial where people were randomly assigned to take a pill or a placebo, so it cannot prove that the multivitamin itself caused those extra deaths. The researchers statistically adjusted for smoking, diet quality, physical activity, alcohol use, education level, and several other factors that could otherwise explain the difference. The small increase in risk stuck around even after all of those adjustments, though the authors are careful to note that some gap could still be explained by factors nobody managed to measure. One group in particular stood out from the rest of the data. Adults younger than 55 who took a daily multivitamin had a 15% higher risk of death than non-users in that same age group, the single strongest association found anywhere in the entire analysis. Beyond that age split, the researchers specifically checked whether the pattern differed by sex, by race and ethnicity, or by how healthy someone's overall diet was, three of the biggest usual suspects in nutrition research. In this case, none of them changed the picture in a meaningful way, which makes it harder to write the result off as simply being about who tends to take vitamins in the first place. The study is not without real limitations, and the researchers are upfront about them. The three cohorts skew heavily toward white participants, which limits how confidently the findings apply to the country as a whole. And the whole analysis depends on people accurately remembering how often they took a pill, sometimes years earlier, which is never perfectly reliable. But taken together, three large cohorts, decades of tracking, and a combined group approaching 400,000 people make this one of the most complete pictures anyone has ever assembled of what a daily multivitamin habit is actually associated with over an entire adult lifetime. And the honest answer that picture gives is not that multivitamins are dangerous. It is something quieter and in some ways more deflating. For a generally healthy adult hoping that daily pill is quietly buying them extra years, decades of the best data available say it probably is not.